Perfect. Okay. So my story, or my narcolepsy story, and I just want to put this on slideshow here. If I do anything wrong, let me know from beginning. And you're good there?
Perfect. Thank you.
Great. So I'm going to focus on my road to diagnosis, which is a little bit complicated, but I've tried to take out the important parts and still make sure that it's a fluid story. I'm from Halifax, Nova Scotia, and I am a retired nurse. I was a pediatric nurse for about 33 years. And this is my story. It is complicated. One thing that when I look back on my story, I keep saying to myself, you don't know what you don't know. And Dr. Peever's story was, or his slides were amazing. I actually was having a little cataplexy because I was really excited about it. And I could feel myself going weak. Anyway, excitement, I guess. So a lot has changed over 30 years since I first started having symptoms, which is wonderful. So just briefly going through the highlights of, my childhood and stuff. I was a pretty normal child. I was a twin. My twin was stillborn. I had the normal upper respiratory tract infections. I had my tonsils out, and elementary school was uneventful. And grade 9 through 10, I had a few strep infections, but other than that, there really is nothing outstanding. High school, in retrospect, I think things were starting to change, but I didn't really recognize it until later. I was starting to notice that I didn't have the same stamina as my peers. So all of a sudden, if I went to exercise to the gym or I went paddling, everybody else would go off to do something social afterwards. And it was all I could do to get home to have a nap. So instead of invigorating me, exercise made me tired. The other thing that I noticed was that I was starting to have these episodes of really heavy legs. And it was mainly when I was overtired, and notably when I was walking home from school at the end of the day. I did have one really bad flu that required hospitalization, not hospitalization, but medical treatment, where I passed out. I was so sick. And the summer before grade 12, I had my appendix out. It didn't rupture, but I ended up in septic shock 5 days later with post-op sepsis. So when I had my tonsils out in grade 7, I decided I wanted to be a pediatric nurse because I had this amazing nurse and it really stuck with me. And I stayed with that. And in 1980, I did a year at Dalhousie University, because I wasn't sure if I wanted to go into the nursing hospital program or the university program. After a year, I decided I would apply for the hospital program. I got in and I started. The month before that, strangely, I actually had whooping cough or pertussis, and I was fully immunized. I was quite sick for about a month, and then thankfully it got better and I was able to start. I was extremely happy to get in nursing. It was my dream. I was local, but I actually moved into residence because I wanted the full experience and I wanted to have the social aspects with my peers. The end of nursing school, I did my senior elective on pediatric neurology and neurosurgery, and I was asked if I wanted a job there. So the times were different, but I was like, yay, of course, yes. So I had an interview and I finished my elective on Friday, and on Monday, I started as a staff nurse. So it was all very exciting. So first year working, I'm sure most people will tell you, is stressful. I really did think it was a good stress. I got my first apartment. I had my first job. I was making money. The mornings were not fun. I had to get up at 5:30. I've never been a morning person. It was really, my brain took like an hour and a half to kind of really wake up. And shift work, I'm sure didn't help. It was 50% days and 50% nights. But all in all, it was pretty standard for a 21, 22-year-old. About 6-7 months into my job, I had a strange spell when I was holding a baby. I remember it very well. I was sitting across from another nurse and I was actually feeding this baby and I had this strange feeling in my head. It was frontal area. It was an odd feeling, not a headache. I knew it wasn't normal. I didn't know what it was, but I knew it wasn't normal. And I was very aware that I was holding somebody's child. So I said to my friend, here, can you take her for a minute? And she did, and didn't ask any questions. And right after she took the baby from me, I slid off the floor onto the floor from the chair. It was very odd. I don't remember the particulars. I just remember I didn't like fall over like this. I just kind of, I felt like I slinked down. A couple of weeks later, I was in the CAT scan room with the resident and a patient that wasn't very stable. And the resident was on one side of the stretcher. I was on the other side. And all of a sudden, I just hit the floor. Like she looked up to say something to me and looked beyond the stretcher, and I was gone. And I remember them putting me on a stretcher, putting me out in the hall, and I was mortified. I was like, this can't be happening. And so the resident was in with the patient and I was in the hall. And I remember taking a sheet and putting it over my head in case somebody I knew came along. A few weeks later, after this, I was in some training and we had a new defibrillator. And when it was on education mode, it made this really high-pitched noise. They didn't warn us about this noise. I mean, I don't know why they would, but I remember it caught me off guard and I was startled and I collapsed to the ground. And this obviously was strange. This was not normal behavior. So I'm starting to think, okay, there is seriously something going on with me. But I felt well in between, so it was very odd. I just kind of kept going on. I did notice that I was starting to need my breaks. If I didn't have a break or I didn't get to eat, I would go in the bathroom and I would sit down and I would just close my eyes for 5 minutes and I would just kind of relax and recoup. Maybe I was meditating. Didn't have the name for it then, but it might have been what I was doing. The other thing was I basically worked and went home and went to bed. And when I spoke to my friends, especially friends who were working in ICU and other really, intense areas, they would say to me, you know what, we all do that, right? Like it's your first year, it's a high learning curve, you're putting a lot of energy into it, don't worry about it. So I thought it was normal. Until so I was having these intermittent, would go weeks, sometimes in between, sometimes it'd be in the same week, but I would say, oh, I didn't eat, or my blood pressure must be low. And I did have lowish blood pressure. I was having deja vus almost daily, and they were disturbing to me on days that I would have many of them, but I would also have a feeling of prescience with them. So I would be talking to somebody and I would have this very strong feeling that I've done this before, or I could anticipate what was going to be said or going to happen. And when I would have a lot of them, I did find it very disconcerting. There were some days that I felt that I was actually confused and I had a sense of depersonalization. And one day in particular, I remember being in the medication room, which was quite small. And I was drawing up meds and I had this sense that I was in a box and everybody else was kind of outside of the box far away. And at this point, I was really starting to get concerned. I also had some issues with some dates and times during them. So I started to question whether I was actually safe at work. I was missing work more frequently, and that bothered me mostly because I felt like I was letting my coworkers down, and there's nothing worse than being short-staffed on a good day, only to have somebody call in sick. So I was doubting myself in many ways. Number one, in terms of my, my reputation as a nurse and a new nurse, trying to, show that you had everything that, it takes. But also as a person and a friend, I just felt like I wasn't reliable. I put the Cheshire cat here because his face just, it's kind of how I felt. I just felt really off kilter, like reality was not quite right. And we know what story he's in, so. I went to my family doctor and I discussed what was going on, and he felt very strongly that it was stress. He felt that this was a very intense workplace. I wasn't getting breaks. It was all kind of a cumulative thing. And he said he was going to send a psych referral. And I was actually okay with that. I was, it makes sense, cover all the bases. But I really felt that it wasn't stress. Like I just had a feeling it was something else. As I was leaving the room, he was writing out the referral to the psychologist, or I think of psychology. And on the bottom of the page, he wrote, patient is a new nurse working in a high stress area, or something to that effect. And he started in red. And I wasn't happy. I thought to myself, you're passing on your bias. Should this person not be seeing me and doing an assessment and interview or whatever and coming to their own conclusions? So I just felt like it was dismissive. I had some ER visits, more than a few, and I ended up going to a neurologist, and I think it might have been the emergency room that referred me. I had a CAT scan that ruled out a brain tumor, which I was quite thankful for. MS was thrown around a little bit, but ultimately I ended up quitting my job right before this. But ultimately they decided that I had basilar artery migraine, and I was put on 2 medications for this. And one of them gave me crazy dreams, just, wilder dreams than I normally have. But that was a diagnosis. It was something to work with. So I was okay with that. So my self-esteem was low, which was not usual for me. I probably could have used some psychological support or mental health support, although back then I don't think that was on the radar. It was really focused at diagnostic. But if it truly was stress, I think, or even if it wasn't, I think that would have been helpful. And I was starting to feel like I was under a microscope. This started to consume my life. I had really important or very supportive family members and people around me, which was awesome. It really helped me kind of keep my spirits up and get through it. Shortly after this, I was hospitalized, and the reason for that was because the medication for the basilar artery migraine was not working, and I was actually still having symptoms, or they were worse or a little different. So this neurologist admitted me to the neurology unit, and I had more EEGs, CTs, blood work, the whole thing, and they ruled out anything cardiac. While I was an inpatient, something strange happened, and I've got little Alice in Wonderland sitting here because the look of bewilderment. But what happened was I was walking down the hall, just trying to bide my time between tests. And I was walking past the nursing station. And as I was walking, I had this feeling that I was getting shorter. So I felt like my whole body was shorter as I walked. And I felt like I was 2 feet, 3 feet, like just really tiny. But strangely, I remember looking over the nursing station desk and I could still see over it. So that was probably like, 4.5 feet or something. But I had this sense that I was shorter. So it was very, my perceptions were all off. It was quite upsetting. I went back to my room. When I got to my room, I told my friend, Margaret, who just came to visit, and she said, you have to tell somebody. So they sent down a medical student, and actually he was quite lovely, and he was quite excited. And he said he'd have to discuss it with the staff neurologist, but he felt like he knew what I had. So in comes the neurologist, like almost right away. And he was actually excited as well. He said, I think what you had, he had me describe it again and answer questions. He said, I think you're having something called Alice in Wonderland phenomenon. I never heard of it. I was like, explain that to me. And he did. And he said, I think that you have temporal lobe epilepsy, and that's why you're having these kind of strange things happening. So I was actually okay with that. My EEG was normal, but I didn't know from working as a neurology nurse that you could have seizures, but have it in your deeper in your brain and not pick up on an EEG if you weren't having an event. So this made sense to me. And it was actually something that I could work with, I could get my head around. And it also gave me hope because I knew that there were medications for epilepsy. it wasn't something psychiatric that, would be with me my whole life and wouldn't be able to be treated. So it did give me some hope. So medications are wonderful, and everybody who's on them for any length of time will tell you that it's not always straightforward. So I had many adjustments to my meds dose and the type of meds, and I had to deal with side effects. So there were days that I was in a brain fog. I felt like I had a strange head, and I had difficulty with cognition. And one medication in particular, an anti-seizure med, I remember I could barely add 5 and 5. It was very difficult to do anything that required any mental, math, if you will. The other thing was some of them made me really sleepy. And one anticonvulsant, I literally lost a week of my life. I slept the entire week. So despite all that, it seemed like I was kind of getting on the right meds. And I was like, okay, I've got this. I've spent enough time on this, year 2 of my life. I'm going to go back to school. I'm not working. I was living in home again. And my parents were very supportive. So I went back to Dal and I started my nursing degree. And I didn't have the confidence to go back to nursing to do floor nursing. So I was like, I'm going to do a few shifts a month, and I'm going to work doing home care, and that will ease me back into the nursing world, if you will. Unfortunately, most of them were nights, and I was going to school in the day, so that wasn't ideal. And this is just pictures of Dalhousie where I went. So 1987 was a big year. I was 25. So this going forward a couple of years, I got married. I graduated with my nursing degree. So I had my degree and my RNs. I bought a house. My social life, I have lots of wonderful friends. I was never the life of the party. I was the one who was going to leave early, or I might nap at your party. But I was on medication and I felt like I knew what I had. I had my first pregnancy at age 29, and I had hyperemesis, and I had to go on medication because of extreme sickness with that. And my son was born, and he was healthy. It was wonderful. We were excited. And almost right after that, my joint started becoming sore. And it was very strange. I'd never had a sore joint in my life. I had trouble changing his diaper. I would be in bed and I would have the sheets over me. And if they were on my toes, it would actually hurt my toes. So on to rheumatology. I had a slew of blood work. I was told I did not have rheumatoid arthritis, which was wonderful, and there's none in my family. I was told it was idiopathic and they would treat it symptomatically, and I was put on chloroquine. So hydroxychloroquine was used for joint pain, I guess, at this time, early 80s. And almost immediately I started having a really weird head, these strange auras. And after about day 4, I called the rheumatologist and told him, I said, I can't stay on this. It makes me feel really weird. And he told me it had nothing to do with the drug. And I was like, well, I was fine before I was on it, and now I'm not. So I really feel like this is making things worse. So I'm like, okay, I'll give it a little more time. And then I was at work one day, and I won't go into the whole long thing, but I ended up having a seizure. And one of the neurologists that I worked with him for 30 years, actually, he was with me. And I had a full Jacksonian march on the left side of my body. And I remember him talking me through it and saying, Sheila, you know what's going on. You're having a seizure, blah, 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 kind of getting me through it. So the next day I went down to the pharmacy. I had them do a literature search, and they found 5 cases of women, I believe all in their 40s, who had had seizures while on chloroquine. So I called the rheumatologist. I stopped the drug myself, and I actually didn't go back to him. And I continued treating the joint pain on my own with over-the-counter pain meds. And eventually it did go away. So I'm not sure what that was. In 1995, and I have some family photos here, my daughter was born. And over these few years, I was still having intermittent med changes, sometimes changing of doses, but I was now on my 4th medication. I was working 4th anti-seizure med. I was working full time. I had 2 children. And thankfully, I had a supportive husband at home that could help run things while I was trying to manage myself and working. In my late 30s, enter something new. I was on nights and I started to have an irregular heartbeat. It was really mild at first. It was just kind of this flutter. And then I was like, oh my goodness, what is that? And I would have coworkers have a listen to me. And then one night they put me on a monitor and they're like, yeah, you need to go to a cardiologist. So I was still having ER visits. I really didn't think I had any cardiac issues because that had been ruled out, but I did have another battery of tests through cardiology, and I was diagnosed with an idiopathic arrhythmia that came from my ventricle, left ventricle. At this point, I was on metoprolol, put on metoprolol. I was on it for 2 years. Then I was put on verapamil for 5 years. Both of these are antiarrhythmics for your heart. I was still on seizure medication, and I was having heartburn, which was quite bad. And I was put on proton pump inhibitors and sent to a GI doctor at one point in there. So my joint issue got better, but then in my late 30s, I started having some sore joints again. It wasn't as bad, but I also had this severe heartburn and was having to take stronger medication. And I had developed Raynauds syndrome, which is, many of you know, it's when your hands don't tolerate the cold and they would blanch to white, and then they would turn pink and then purple and different colors. So it was an issue with my, microcirculation. I went to a rheumatologist who did my second rheumatologist, and she did a CAT scan of my chest, a lot of blood work, pulmonary function tests, etc. And it came back that I had a positive ANA, or anti-nuclear antibodies, and a positive SCL70. I had never heard of this. But anyway, with my symptoms and the positive ANA, they told me that I had crest scleroderma. And I really wasn't familiar with that as either. And I did some research and it was terrifying. It was very upsetting, but it was what it was. It was one more thing that I had to deal with. I was on several medications still, and I was now on my 5th seizure medication. I also saw the internal medicine specialist at this point too. So I really clearly remember saying to many specialists, I'm only sick when I'm tired. And I remember saying it to my family doctor too. My heart's only irregular when I'm tired. Why do I only have these symptoms when I'm tired? And I have one cardiologist said to me, that makes no sense. Your heart has nothing to do with your brain. And so the second cardiologist that I saw, he was actually quite lovely. He was really good. He had a great reputation. He was young. He was funny. We had a great rapport. But when I first went in, he said, are you Sheila? He thought I was in the wrong room. And I said, yes. And he said, oh, he goes, you don't look like your chart at all. And I looked, and we had paper charts then, and he had this huge chart. And I said, well, I'm going to take that as a compliment. And he kind of apologized, and he said, well, I was expecting somebody that looked sicker. He goes, you look really healthy. And I said, thank you. So in my early 40s, I saw my 4th neurologist. And, in between this, my life is happening. I have kids, we're going to regattas, my kids are into sports, we've got school work, all these things, and my husband is working, of course. I go to see this neurologist because I had called the nurse and said that my meds weren't working and I was symptomatic again, and it was much worse or different. So the neurologist said, no, you need to come in. So I came in, and I'm sitting there talking, and he's doing a history, and his nurse is with him. And he looked at me and he said, there's something really strange about your story. And it was the first time I met him. And I thought, yeah, I think so too. But anyway, he said he was wonderful. He had a great bedside manner. He was an excellent interviewer. And I really felt like, oh, this is the guy. And he said to me, do you mind if I admit you for a few days? I'd really like to do a video EEG. So because I worked on pediatric neurology, we had video EEG patients all the time. We actually had like a telemetry unit for this. So I also explained to him that I had something that I called affectionately Teflon brain. And he said, what is that? And I said, well, that's my pet word for the days that I can't remember anything. And he said, what do you mean? And I'm like, I have days or parts of days that my short-term memory feels like it's completely gone. And somebody can tell me something and it's like my brain's trying to grab it and it's sliding right off. And I also explained brain fog to him, but I don't think I used that word, but just a feeling of my head being muddled. And the short-term memory difficulties were concerning because there is a history of Alzheimer's in my family. So in the back of my mind, I did have early onset Alzheimer's as, something that might pop up, what I was really hoping wouldn't. I explained that my dreams were extremely vivid and that I had trouble some mornings distinguishing between a dream and reality. And I would say to my husband, did this happen? Or did we have this conversation or whatever? And, it was usually my dreams. So he admitted me to hospital and I was fine with that, but I really didn't expect anything to come out of it. He discontinued my anti-seizure medication and told me that, it was fine. And I'm like, but what if I have a seizure, rebound seizure? And he said, don't worry, we'll look after it if you do. And I was like, easy for you to say. So I was there for over 24 hours and the EEG tech came in to redo some leads. He woke me up at like 7:30 or 8 and he was fixing some leads that had come off during the night. And we were chatting and I remember being so tired and thinking, I can't even talk to this guy. Like, I'm so tired, but he was like, oh, you work over at the kids. And, he was wanting to have a conversation and I could barely stay awake. I was literally, my head was lagging. And he said, can you stay awake long enough for me to go down and get some leads or some paste or something? And I said, I don't know. He laughed and I hopped in the bed and I was out cold within 2 minutes and he came back. So in comes Dr. Sadler, the neurologist. And at this point, I could barely stay awake. And I didn't expect to see him. I figured that a report would go to my family doctor. I would get a call. She would read it to me and tell me the next plan. So I was really surprised to see Dr. Sadler walk in. And he had a strange look on his face. He walked in the room, he grabbed a chair. He comes over to the side of my bed. He sits down and he just looks at me. And I said, what? Like, what's wrong? And he said, Sheila, I've been going over your EEG. And last night I watched your video and your EEG while you were playing crib with your friend who was staying, the game cribbage. And he said, you were having tons of microsleep. And I said, microsleep, what is that? And he said to me, he explained it and I had never heard of it. And I remember thinking, okay, like, what does that mean? And he said, I think that you've been misdiagnosed. Can I ask you some questions? He asked me if I slept well. I said I did, but very deeply, and told him about these dreams. And he said, do you ever nap? And I said, I nap every day. And as it was coming out of my mouth, I made a joke actually, because I remember feeling, oh my goodness. But then I made a joke and I said, oh, I come from a long line of nappers. I think I didn't want him to think I was lazy. And he said, that's not normal. What if you didn't nap? And I said, Dr. Sadler, if I didn't nap, I would be, I couldn't function. I just would have to nap. Like, there's no question. So he asked me how I got through a day at work and my off days and what the differences were. And then he asked me if I felt restored after my naps. And I said I did. I felt great. I could go again. And then he asked me about the mornings. And I said, no, I very rarely felt awake and invigorated when I woke up in the morning. So then he says the words, I think you've been misdiagnosed. And it was just like this echo chamber. It was kind of like how I remember it. I think you've been misdiagnosed. I was like going through everything in my head that had happened to me, and nothing was making sense. And once he said the word, I think you might have a sleep disorder, I started looking back and started thinking about my sleep in earnest. And he said, I'm going to call the sleep lab because you can't wait a year, 18 months or whatever the wait is right now. I'm going to push to get you in. So about 3 weeks later, I was in the sleep clinic and I had a multi-sleep latency test. And I remember when the tech came and was asking the questions after your nap, and she said, did you sleep? And I said, yes, no, I don't know. Well, I dreamt, so I must have slept. Yes, because I had a dream. And she's looking at me like, and I'm like, okay, as I'm saying it, I'm like, that's not normal. So a couple of weeks later, I saw the sleep specialist. She had reviewed my MSLT and asked me questions again and reviewed my chart. And she said, you have textbook narcolepsy. So I was floored, absolutely floored. I knew nothing about narcolepsy. And embarrassingly, I said, you mean like those people who fall asleep in their soup? I actually said that, which is embarrassing. But anyway, so when she asked me specific questions, it was clear I had had sleep paralysis about 5 times in my life. I think at some point I had read that normal people have it, so I didn't worry too much. I did have hallucinations, hypnagogic and hypnopompic, but I felt they were dreams. I didn't recognize them as hallucinations. My daytime sleepiness, I now know my sleepiness did not present as sleepy. It had a lot of other ways that it presented. And to this day, it does not usually present as sleepiness. It's just these other symptoms of my head not working well. And I have trouble finding words and my speech gets slurred sometimes. And my cognition just goes, my cognitive abilities suffer. Then she asked me before this, obviously, before she told me I had textbook narcolepsy, she asked me if I had any of these events, these fainting with emotion. I literally got chills. She made me go through the biggest events that I had had and what happened. And it was clear that to her, she was like, you don't need an LP, a spinal tap. Like I am so confident you have this, like you click all the boxes, including my blood work came back as positive HLA DQB 10602, which is, as you know, positive in those with narcolepsy type 1 generally. I didn't have disruptive sleep, but that would come later. So also somewhere in this journey, I talked to my mother about sleep and I was having restless legs, but I didn't know what this was. And she goes, oh yeah, you have restless legs. The whole family has it. And I'm like, what? How did I not know this? So anyway, I do have restless legs and some nights it's worse than having narcolepsy. I started on Effexor modafinil, which I'm still on, and they still work quite well, actually. And I'm reluctant. I will be honest, I've had so many med trials that I'm reluctant to try anything else. I do remember I was vacuuming the first day that I started it, and I was singing. I was like, is this the way I was supposed to feel? Like, it was like a puzzle was missing from my brain. Somebody put it in, and all of a sudden I was whole again. And that sounds really dramatic, but that's how I felt. It was that dramatic for me. So I wrote a list of some of the tests and the specialists that I saw, and it really blows my mind when I look at healthcare dollars and the money that was spent on me. And to be fair, sleep medicine was in its really non-existent in the early 80s, and it's only 99 that orexin or hypocretin was found. But imagine if we had known this and I had gotten a diagnosis sooner. The only medication I take now is narcolepsy meds, which is amazing to me. My arrhythmia went away. My ANA has turned back, like it is normal. I don't have Raynauds anymore. And it's mind-blowing to me that once my sleep got sorted out, everything else kind of fell into place. So almost 5 years ago now, I had to quit my job and I was quite upset. The months leading up to leaving my job or having been told I had to quit my job, there was a code blue call when I had a prolonged cataplexy. And I could do a whole talk just on that because obviously I was aware of what was going on. I could hear the whole code team. They're trying to figure out what to do with me. I've got a narcolepsy bracelet on with cataplexy. I've got everyone around them telling them I have cataplexy. And anyway, it was really something. the other thing was I have my picture of my birds here. I have cockatiels that I had that were rescue birds. And I was in neurosurgery clinic and it was the end of the day. And I remember it was the last patient and I was so tired. And I'm going down the hall and I hear my cockatiels singing. And I'm like, okay, I shook my head and I'm like, okay, you're not really hearing this. And I'm hoping it's just going to go away. And it gets louder. And it's literally like I have these two birds singing in my ear and I cannot make it go away. I can't suppress it. But I need to go in and do teaching with this patient that has waited a year to get into our specialty clinic. So I have to do it. So I go in the whole time I'm teaching, which was about a half an hour, I'm blocking out this sound. And the next day I called my sleep doctor. She had been increasing my meds and up to a year before had wanted me to retire early. And I was 53 at this point, and she was wanting me to retire and not wait to 55. So I quit that day. She literally sent something over saying I was off for medical reasons indefinitely. And I was very sad. I was disappointed. And I did feel again that I was letting people down because I literally walked out on my job and there was nothing I can do about it. So I left everybody hanging and my desk full of things. So I did take some pictures at the end of a cataplexy. So the ones on the left, I had just had a full body cataplexy and I was coming around and I remember I was by myself and I remember thinking, oh my gosh, I can't smile. Like my face is so weak. And I remember thinking, I got to get a picture. So I don't know why, but I took 2 pictures and wow, to me, like I was trying to smile and you can tell how droopy. I look like somebody who has myotonic dystrophy on the left or somebody who has a facial palsy or something like that. The one on the right is actually in a beaver enclosure. Anybody who has narcolepsy will tell you that you have to live your life the best you can, but still, manage with this disease. So I had a cataplexy attack. We were shoveling mulch and we were getting ready for new beavers that had come in injured and they came back. There was no beavers there and I was sound asleep in the mulch. It was quite comfy actually. And they took a picture and sent it to Hope, my boss. So I decided that if I was going to have this, I was still going to have the best life. I couldn't be a nurse, but I had a lot of skills. I still loved teaching. I loved health education. And I decided to embrace this. So I got in contact with Julie after seeing her on social media. And I took the Rising Voices of Narcolepsy course and I started doing talks in schools. I did one at my local hospital. And then I went to 2 Narcolepsy Network conferences. And in Albuquerque, I was on a panel to discuss what it's like to live with cataplexy. And finally, I decided to share this, and I just added this morning. I was sitting in a waiting room and waiting for a resident to go over my chart, and I could see him through the crack in the door. And I picked up a pen from my purse and I wrote this. So I'll close with this. Waiting again, same old posters, magazines, pink institutional walls. Waiting for this doctor. I see him through the crack, reading my chart, my story. He's a stranger, an unknown to me, in charge of me. I am in charge. We are partners. Does he know this? He, with his knowledge, his confidence, me alone, tired, vulnerable. But wait, I have everything he needs to do his job, if only he asks me the right questions. And that is my story. Thank you very much for listening.
Thank you, Sheila. That's an incredible journey. Way too long.
I talked too fast, though.
No, I meant way too long that you're having to wait for a diagnosis. What a crazy year that was for you.
Yeah, crazy.
So yes, I'm sure many of our audience can relate to some of those points where, we've all fought for a diagnosis. But I do have a question for you, and then we're going to break for 5 minutes.
Sure.
Could you speak about your experience with support groups?
I did. At our very first support group, there was 9 of us, and I almost cried. We sat across the table from each other, and we were just in awe that there were other people who had this, and I did, yes. And we shared a lot, especially over the first year.
Okay, where was it?
Where was our support group?
Yes.
In Halifax, Nova Scotia.
Okay.
We actually hosted them in a conference room in the hospital, but had been talking about getting away from there and never did.
Okay, so is it still ongoing? Is that a group that people listening might be able to access?
Well, there is a Narcolepsy Nova Scotia Facebook page, and most of the people actually people were having trouble getting there, and we ended up having more talks on Instagram and on Facebook. And to be fair, a lot of people, we do private chats as well. So going, especially with the pandemic, going to something that's more virtual would be much better, because there are a lot of people outside of our city who'd like to access.
All right, so how do people access those groups online in terms of Facebook and Instagram?
Right. So the Narcolepsy Nova Scotia, they can, for now, until I get, other things set up with you guys, right now, they just send a request to be a member. They just look up and then I add them. And until now, I've been going through the sleep clinic. So when they have a new diagnosis, they ask them if they're interested in a support group. And if they are, then I have an email, and it's narcolepsyhalifax@gmail.com, and that's given to them, and they contact me. So the onus is on them. And I get probably a call a month, and some calls can be up to an hour. And people give me feedback that it is helpful.
Okay, thank you. If you want to know about the support group that Sheila is running as part of Wake Up Narcolepsy, then please sign up to our e-newsletter, which is on our website. That's www.wakeupnarcolepsy.org. Follow us on social media, Facebook, Instagram, and Twitter at Wake Up Narcolepsy. But Sheila, thank you so much for joining us. Really look forward to your Canadian support groups, and thanks again for supporting Wake Up Narcolepsy.
Thank you, Claire.